Hi, welcome to Cancer Close-Up. My name's Devan Voight, and I'm one of our chaplains here with WVU Medicine's Cancer Institute, working in inpatient and outpatient oncology. And today, I'm joined by Ashley Denardo, one of our social workers.
Yeah, I cover the breast, head and neck, and brain clinics at the Cancer Center and help our patients afford and access their care. I'm happy to be here today.
No, we're certainly happy to have you here as well. So, as you know, you and I have been working together on an AYA program, which is Adolescent and Young Adult, specifically on how to have a conversation with children regarding a cancer diagnosis. But before jumping into that, I thought maybe you could clarify a little bit about who falls under that AYA population.
Yeah, so AYA patients are patients between 15 and 39 years old. And this population has more unique needs than maybe the rest of the cancer population. People in this age group don't really expect to have cancer. I mean, not that anyone expects to have cancer, but in the middle of, being a young person or going to high school or college or starting a family, it's just not something you expect to encounter.
Yeah, well, certainly as young people ourselves, we tend to think that we have so much time ahead of us and that we're going to be completely invulnerable to some extent. And when we have that news come across our way that there has been some form of diagnosis around critical illness, especially with cancer and the stigmatization that cancer still holds, I mean, that can be pretty ground shattering, whether you're in high school, college, family planning even. I mean, it's not something that you ever anticipate to happen.
Yeah, so when you're starting a family, and you get this news, it can be really hard to know how to have this conversation with your family, and especially with your children.
Yeah, I imagine that a lot that goes through one's mind in that situation. How do you even begin to broach that subject? How can I explain that accurately to my child? How can I still love and care for my children in the process of that? Or even for older patients who fall outside of that AYA range, how do I have that conversation with my grandchildren? In the work that I do with patients, I've often found a lot of that initial conversation starts with grief. And I'd imagine as a social worker, you've probably had some similar experiences with that.
Yes. And I think that, it starts with the patient really reflecting on themselves and processing their diagnosis, which even through receiving some treatment, they might not even still have processed that initial moment or shock of the fact that they even have cancer. So getting through all of that first before delivering that news to their children is an important step and something that they have to be actively involved in to get to.
Yeah, I've certainly had that encounter with many patients where from the moment of diagnosis to setting up doctor appointments to getting infusions or radiation scheduled, perhaps even surgery, it can happen so quickly because cancer is one of those things that when you are diagnosed with it, time is of the essence, and generally medical providers want to act as quickly as they can. And while that's all well and good, I have encountered a lot on the patient side of things. There is that shock and still that difficulty to set aside that time to process, what does this mean? What's this new normal going to look like? How do I even begin grieving this, much less how do I sit down and tell my family?
Yeah. I had a patient recently who was diagnosed maybe 2 months ago, has gone through surgery, is starting radiation, and her mind, she's still in that room getting told that she has cancer. She just finally got the words to say, oh, this is actually a crisis. This is what I'm experiencing. So it's finally starting 2 months later down the line, going through all of this. So it's not something that just happens overnight, and it's not going to be easy, but she's getting there.
And I'm sure that grief, too, is something that it is carried with you every day, and it's going to be re-encountered every day in different ways. But I do really like what you said about finally having the language to talk about it, because language often is what helps us to not just have those conversations with others, but to have that conversation and that movement towards acceptance in the grieving process with ourselves.
So once you have the language to describe kind of what you're going through and you're able to process your grief, an initial shock, then you can, use that language to enter into those conversations with other people about your illness.
No, I think you're right. And it's going to certainly look different depending on who it is you're talking to, right? We talk to our spouses or partners differently than we would talk to our close friends or our coworkers or our parents even. And definitely we kind of have that filter on naturally, I think, when we talk to our children, because we want to protect kids from anything that could cause them harm. And grief is one of those things that unfortunately does cause emotional harm and heartache. And grief is also a very natural part of this process. I don't think anyone can go through something like this without experiencing grief.
And I think in trying to protect children, often people hold off on the conversation because they think that's protecting the child. And in doing so, it can, rather than, having the parent available to explain what's happening, the child's noticing changes when you're ill, different things happening with the routine, different physical changes in the parent. So not addressing it can cause the child maybe to internalize that as maybe something that they did wrong, or some shame or confusion about how they're feeling or what's happening. So having the conversation can be more of a protective measure.
Yeah, rather than leaving it to the imagination of the child to kind of fill in those blanks, you provide concrete answers to the questions that they may already be having. They just, to go back to your point earlier, maybe they don't have the language to ask what those questions are. And again, this conversation is going to look very different by age range. It's going to look very different from child to child as well, based on developmental stages, comprehension level, perhaps even the activities that you might want to incorporate into that conversation around, these are the changes that are going to be happening due to this illness, and this is what this means. Right.
Generally, something that's helpful for all of the, I would say, age groups would be, focusing on the initial changes that you'll see. So maybe dad is more tired lately and can't get off the couch as much and help with things, or take the kids to soccer practice or something like this. Or, mom knows her hair is going to start falling out from chemo. And so having these conversations to focus on those changes and how that's going to impact their reality is really helpful. Scheduling and when giving that information to the children, like we were talking about activities that they can do. So in younger children, it is helpful to have Play-Doh or blocks or something to use their motor skills to stay more focused, and to get their mind off the discomfort of the conversation during that time as well.
Yeah, having that tactile experience to it. It almost makes me think of how sometimes when adults will even hang out, they'll want to go have some intermediary they're doing, it's bowling while they have a serious conversation, or golfing, or fill in the blank to whatever that might be. But actually the other day in the clinic, I encountered a patient who was having that very question of, how do I have this conversation with my grandchildren? They're young. They are on varying levels of understanding. But for her, she knew that they were going to start seeing the side effects of the treatment, which one of them that they anticipated would be her hair falling out. And so she met with her adult kids over this. They had a conversation with themselves and went to the grandchildren, and together as a family sat them down and kind of explained, this is what's happening to grandma. And to invite the children to participate into that, they actually decided that they would have a haircutting party, a way to preemptively, in her words, shave her head so they didn't have to see her hair falling out bits and pieces at a time. But it also gave them an experience to come together as a family, to have more of a concrete understanding, and to recognize that while cancer certainly can be a very terrible thing, that there is not only negative in it, but that, in her words, you can choose the positive. You can choose to impart life lessons and make meaning and find purpose despite the suffering and the grief that is present.
Yeah, it sounds also like that can give them a sense of control over the situation too. Like, I know this is going to happen, but I can kind of choose how it happens, when it happens, and who it happens with.
And that, I really like that point, because cancer is, again, one of those things that nobody seeks it out, nobody wants it, nobody really does anything to cause it or deserve it. And so much of it is out of their control. But to find elements where control can be taken, right? I mean, that is a very powerful thing. And then again, to invite the adolescents, the children, even the young adult children, right, into that experience together.
Yeah, absolutely. And with that, having these conversations, even if there's a positive aspect to it, it's not easy. There's different ways to go about it, like making sure that you choose the right place to tell the kids what's going on, sit them down at eye level, things like that, and.
Yeah, I imagine setting the tone does make quite and again, in our work, right? So much of the conversations we do have with patients and family involve setting that tone, choosing an appropriate time, the appropriate language, not making it rushed, but really setting time aside with intentionality to be patient through that conversation.
Exactly. And, with different age groups, talking on levels that the kids are going to understand what you're saying, maybe sharing, as kids mature, they'll have a more interest maybe in the scientific nature of your illness, but when they're younger, more just reassurances and closeness, I think, is more appropriate.
I think even at young ages, right? Children have exposure to cancer already, whether they've heard it from a classmate or a playmate or from their teachers, or even picking it up on commercials or shows on TV. The colloquial nature of cancer is out there, and often kind of the stereotypes of it tend to be present as well.
Yeah. It's kind of a murky thing when you don't know much about cancer. I know before I entered oncology social work, I didn't really know much more than what you see on TV. So you hear cancer and you think worst case scenarios, but there's always positive aspects to situations, even with something like cancer. So it's important to focus on those positives. Like, for example, I think science is changing all the time. There's always going to be new treatments coming out. We have more targeted therapies, so chemotherapies that are based on your gene expressions and things that are causing the cancer or feeding the cancer. And so, I have a patient who, she had to tell her child she's got stage 2. She's a single mom, stage 2 breast cancer. Single mom with 3 children. And she's like, well, I'm able to tell them it's, I have HER2 positive. I'm getting this treatment. I have options that are concrete, that are well studied. I know that my outlook is better. So those kind of conversations, like her life obviously has changed forever. But by sharing those positive aspects, it creates hope for those outcomes that kind of contrasts with the uncertainty that cancer brings.
No, I think you're right. I mean, I've certainly encountered many patients on both the outpatient and inpatient side who have even been able to pull life lessons from cancer. And it can be a weird thing to say, like, what can cancer teach you or what can illness teach you? But what I found in talking to them is when they're open to kind of approaching that with curiosity. I've met many patients who have said, the things that were important to me then are no longer that now. What's important to me is family, is time with them. It's a perspective and dynamic shift.
Yeah, clarifies their priorities and values.
Yeah, it certainly can. And I think as well, and we've talked about this before, but, from some of my personal story, when my mother was going through her genetic testing, finding out that she had BRCA2 and that had been something that was pervasive through the family, I was one of those adolescents. I was in high school, I think a junior in high school, and I was picking up very clearly that something was going on in the house. More family members were coming over. It was a somber atmosphere, and I was kind of filling in the blanks myself. And I had to go to somebody outside of the family who had heard about it to really get the full story, because my mom, out of love, didn't want to share that with myself or my sister, out of that protection. And I think to some extent, while well-meaning as it was, it did cause me additional distress until I finally learned what's going on and I had my questions answered. And that was able to kind of soothe me, because now I was on the same page as everybody else.
Yeah, that makes sense. I think, like we kind of talked about earlier, but we're trying to protect our kids by shielding them from things, when opening an honest conversation can help kind of prevent shame or guilt, and leave space to validate the actual emotions that might come up. Like whatever someone's feeling when they get, as a patient or as the child receiving this news, there's no right way to receive this news or right way to feel when you receive it, whether you're angry or sad or scared, or all of those things in a mix. So, maybe people will tell their kid, oh, you're too young, don't worry about it, or something like this. But, in reality, just validating their fear and saying like something, it's okay to be afraid, would be more effective, I think.
Yeah, I know that there can certainly be phrases that are tossed around, such as, well, everything happens for a reason. And sometimes that can offer some comfort, and other times there isn't always an easily attributed reason to what's going on. And those phrases, again, as well-meaning as they might be, to offer that comfort or assurance, can sometimes have the unanticipated reaction of pushing those emotions away, bottling them up. And then I think that can make it more difficult. Again, from my experience, it can be harder to ask those questions, because now, is the door open to have that conversation? If so, what does that even look like?
Yeah, absolutely. And along those lines, like, people will say things like, well, at least it isn't this, or at least it's not worse than stage 1 or something. But, or at least to a child, I guess it would be more like, at least
you still have time. At least you're young enough to, like you said earlier, to not have to worry about that.
Yeah. But that's just minimizing, the child's reaction or grief, and kind of glossing over the reality of it. And I think the basis of this conversation is just to confront what's actually happening together and be vulnerable together in that. Also, not overpromising, setting realistic expectations with your children of what the new normal, like you mentioned earlier, is going to look like. Mom might not have the same energy she had before to do all the things you expect that are going to happen in a day or a week. So not just trying to keep everything as, you want things to stay normal, but you can't expect that they're going to be exactly the same. So trying to adjust what that looks like.
And adjusting those expectations can be hard when we often want to preserve our sense of normalcy. We want the homeostasis to be undisturbed. And I think that can lead to, again, out of love and good intentions, can lead to overpromising that, well, this won't change or this will stay the same, when in actuality, we don't always know if that will or won't be the case. And I've heard it said many times, and found it true myself, that it's always easier to say no or set tighter expectations and then expand them later, or to say no and say yes versus to say yes and then have to go back and say no.
And it can be hard to know, like, how to set these expectations or how to have this conversation, even with all this information. And there's a lot of resources at the Cancer Institute to help support the patient and the children and the family through all of this. We've got, 5 social workers separated by disease process to help. We've got our therapists, we've got chaplains, our dietitians and oncofertility specialists. And also we have the Beauty Boutique, which it's a great resource. You can go in and get fitted for a wig and some other accessories and things like that for free. So we have a lot of things to help support families.
And to the Beauty Boutique, I've had the privilege to meet the people who work there, to even refer patients out that way. And going back to what you said about a situation that is so out of your control, that is another area where you can seize control, right? You might be losing your hair against your will, even if you choose to have a hair dyeing party or a shaving party or something like that. And there's the opportunity to still reclaim some of that self-image, reclaim some of that control over the situation through the beauty clinic and other areas like that.
Yeah, absolutely. And and reclaiming control, there's the beauty boutique. I like what you said about that. And also just, using your resources in the sense of seeking out assistance from other people in your life. And, like you were saying in the beginning of this, we are working on that project to be available to have these conversations with parents and their children. And we have a brochure coming out and the website where you can find more information about everything we talked about today, but also a lot more coming.
Certainly. The hope is that it's going to go into a lot more depth and over time continue to expand with additional suggestions and resources for how to have these difficult conversations. Because again, we recognize that this is uncomfortable, it's hard, it's challenging. There's rarely a guide on how to be a parent. There's certainly not a guide on how to have a conversation with your children when you receive a cancer diagnosis. So we're certainly hoping to be able to bring something like that to the front face of what we have to offer there at the Cancer Center. Well, that's pretty much going to wrap it up today for Cancer Close Up. Again, my name's Devan Voight, and this is Ashley Denardo, and we thank you for having us.